Tailby and I work at Meads Medical Practice and I'm the practice manager. So I first entered the NHS when I was 19 and I came in as an apprentice. I was doing business administration for a year and working out of a practice in Faversham, Newton Place in Faversham. There I did some on-the-job training, obviously through the apprenticeship, looking at how the practice worked while also doing some stuff around how an office generally works. And then I was lucky that the practice wanted to keep me on after the year, and I went into the reception team. Through there I did some more training, obviously stuff that they provide internally, medical terminology, summarising, and then I went on to do more things in the practice. So in the admin side, medical reports, registration, post, and then through that time I also was really lucky that I was able to do some more apprenticeships. So I did business admin level 3, team leadership level 3, and then I went on to do management level 4 as well. Very lucky that practice supported me whilst I was doing those, and then from there I took on a role as a team lead, and I was looking after the admin team with a team of 3 other colleagues looking after the whole office. Through that time we was looking at implementing new projects, obviously running the team. I was also very lucky that I was brought into a research project with Kent University and through Dr. Short that was doing the work there, and I was able to help project manage that process, which I think's helped gain a lot of insight on how things work. And then from there, after COVID, I sort of took the idea to try something a bit different, try a new challenge. So I came to Sittingbourne and the Meads Medical Practice as the practice manager. Initially I was at university and it just didn't work for me. So it just wasn't the right structure for me. So I was looking for an alternative, which is how I found actually the apprenticeship. I wanted something where I could learn, but also get that experience on the job. And to be honest, the reason that I took the job initially was it was location. It was 10 minutes from where I lived, very easy. But the reason that now that continues to motivate me to stay in primary care, which I think a lot of people are struggling with that decision, is that what we do directly affects patients. When we put a new process in place and I can see how that's improved patient outcomes, how that's improved staff outcomes, that's what motivates me now to continue. It's looking at different technologies that we can use. It's seeing how we can be creative. It's a difficult landscape, and we're having to learn what we can do to help patients, help staff, and keep moving in this changing landscape that's happening at the moment. So it's very difficult. I have probably about 20 hats on a day. So 1 minute I may be with my screwdriver fixing one of the things that have gone wrong in the rooms, or the next I'm looking at finances, meeting with different service providers. But generally day to day I'm looking at helping the staff with any queries, any HR issues that we need to go over. I'm here for the patients, so if we've got complaints, compliments, questions, I'm obviously here to explain any processes of why we're doing anything. I'm overseeing claiming to make sure that we're getting everything right, all the processes are there and we're getting paid appropriately so we can keep going. Looking at changes in guidelines, acting on them where necessary, meeting with the clinical team, reviewing any processes there, anything we can improve on, any changes that have come in that need to be implemented. And then just a bit of everything else in between, to be honest. I think recently I was on the phones because we had staff shortages, so it's, other than the clinical work, it's a bit of everything, to be honest. I mean, to be honest, the cheesy answer is the whole practice is a team, and we know that it does take everyone to run it. But day to day I work closely with the business manager here, which is Karen Morgan, and our reception coordinator, which is Peter, and then also the clinical team. So obviously if there's we will come up with the new ideas. They need to make sure that it works clinically and it's safe for patients, and we do the other side of it. But also anytime we do have a new project, I will always bring in any of the staff that work in that team so that they can inform. They do the job every day, so they can give their sense on how it will work for them. Absolutely. In the practice, definitely I've been very lucky throughout my time in the NHS that I've had very supportive managers. That's basically why I'm here. I've been given that opportunity to try different things, take on different training courses and had lots of mentorship, and that continues in this practice. I'm very lucky. Obviously, this is my first role as practice manager, so it's very daunting. And that's why I specifically chose this practice, because the practice manager here, the business manager here is still very hands-on. So she guides me through a lot of the new work that I have to pick up and lots of mentorship. So yeah, very, very supported. So the highlights are, as I've said before, is implementing a new process and seeing how it works. I like lots of data. It's very geeky, but I like to come up with a new idea, put it in place, and then we can analyse it afterwards, see what the outcomes. Something we've used recently, which I became obsessed with, was the AccuRx self-booking. How that is, it's just amazing how that's improved the process. Such a small thing that I came across actually at the practice managers meeting. I hadn't seen the publications about that before, but for a chat at the practice managers meeting, we then implemented it here, and you can just see daily how it's helping the access, and it's helping patients a lot more efficient. So that's one of the highlights. And then I'd also say staff training and progression, because that's how I started. I was given the opportunity to take on different challenges. I'm really keen to make sure, if there's areas that the staff are keen on, we work towards that, and then seeing them go through their training and then complete it and even move on to different areas. I'm really keen, so that's a big highlight for me as well. I think it's probably across the NHS. Obviously, resources and recruitment is a big challenge, especially in Swale. That's patient expectation can be quite a challenge sometimes. Obviously, we're not back to pre-COVID levels in some areas, or actually the demand's probably soared past pre-COVID levels now, I think. So that's a big challenge, and it's just getting that information of moving away slightly from the GP and to our other sort of healthcare professionals that can help. So I think that's a bit of a challenge. Yeah. It's a difficult one to predict, because as I said, the landscape is changing all the time, but I think it'll be continuing to focus on how the allied healthcare professionals can help the team now. I think we need to move away from it's just a GP. What else can we do? We need to continue to be creative, innovative, see how technology can help us. The resources are what they are, so we need to try and find ways that we can utilise that to help our patients in the best way possible, and to help our staff as well. So it's a really hard job being out there and dealing with the phone. So if we can find anything that can help improve access, working with obviously the ICB and working locally within the PCN to see how we can have a more collaborative approach. I think that's what we'll need to continue to do to improve and keep primary care going. I would take on as much training as you can. I think there's always a bit of a fallacy that there isn't much movement in primary care within GP practices, but I work to try and change that impression, because that's exactly what I've done. But you have to take a lot of it on yourself. You won't be handed training opportunities necessarily. You need to put yourself out there, put yourself forward for projects where you can, mentor as much as possible. If you can find a manager that you work really well and can have that mentorship, then I think that's really beneficial. Also, just take on some training outside of work. It sort of dominated my life slightly, looking at all different areas, and it's just trying to figure out what sort of a manager you want to be. Look forward, what are you looking for? How do you want to run your team? How do you want to run your practice? And then put things in place that can help you towards that. But I'd say, yeah, train as much as possible. I still do it now. Anytime that anything comes up, even if all it does is show you that you're doing it really well, I still think that's really beneficial, just to get that knowledge of, okay, I'm doing fine. But if you do pick something up, then that's brilliant as well.